and welcome to this lecture, Artificial Intelligence and Counseling in Treating Substance Use Disorders, where we will examine counseling, the core function most often associated with addiction treatment and behavioral health practices. While screening, intake, assessment, and treatment planning provide the foundation for care, counseling is where meaningful change often occurs. Counseling is the process through which clinicians help individuals explore thoughts, emotions, behaviors, and life circumstances that contribute to substance use while developing the skills and motivation necessary to support recovery. It is through the counseling relationship that treatment plans come to life and recovery goals begin to take shape. Our research consistently demonstrates that one of the strongest predictors of successful treatment outcomes is the quality of the therapeutic alliance between the counselor and client. Regardless of the counseling approach used, clients are more likely to engage in treatment, remain in care, and achieve positive outcomes when they experience trust, empathy, respect, and collaboration within the therapeutic relationship. As discussed in this chapter, effective counseling involves active listening, empathy, open-ended questioning, reflective communication, problem solving, skill development, and the use of evidence-based interventions that support recovery. Counseling is not simply giving advice or providing information. It is a collaborative process that empowers clients to identify goals, overcome barriers, and create meaningful change. Artificial intelligence offers several opportunities to support counseling activities before, during, and after client sessions. AI tools can assist clinicians in preparing for sessions, developing psychoeducational materials, generating discussion prompts, identifying evidence-based interventions, and creating recovery-oriented exercises. AI can also help counselors organize information from previous sessions, summarize treatment progress, and identify themes that may want further exploration. These capabilities may reduce administrative burden and allow clinicians to spend more time focusing on client engagement and therapeutic interactions. For example, a counselor might use AI to generate relapse prevention worksheets, create psychoeducational materials related to coping skills, develop motivational interview and practice questions, or identify evidence-based strategies for addressing specific treatment concerns. AI can also assist clinicians in locating current research, summarizing treatment approaches, and creating individualized homework assignments that reinforce concepts discussed during counseling sessions. In educational settings, AI can provide students with opportunities to practice counseling techniques and explore different intervention strategies. Despite these potential benefits, counseling remains fundamentally different from many other clinical functions because it is rooted in human connection. Effective counseling requires empathy, emotional awareness, cultural responsiveness, and the ability to recognize subtle, verbal, and nonverbal communication. Counselors continuously assess client reactions, adapt interventions, and respond to changing emotional needs throughout the therapeutic process. These interpersonal dynamics cannot be replicated by technology. While AI can generate information and suggestions, it cannot genuinely understand a client's lived experience or establish trust necessary for meaningful therapeutic change. While AI offers significant opportunities, clinicians must remain aware of its limitations. AI generated interventions may be inaccurate, lack cultural relevance, oversimplify complex clinical concerns, or fail to account for clients' unique circumstances. Counselors should be cautious about over reliance on AI generated recommendations and ensure that all materials and interventions are reviewed for accuracy, appropriateness, and consistency with evidence based practice. Confidentiality, informed consent, professional boundaries, and ethical decision making remain essential considerations whenever AI tools are incorporated into counseling practice. Counseling is not simply the delivery of techniques or interventions, it is a collaborative relationship that helps individuals explore challenges, build strengths, and create lasting change. AI can support preparation, organization, education, and skill development, but it cannot replace the empathy, compassion, clinical judgment, and therapeutic alliance that define effective counseling. As you complete this chapter, consider how counseling facilitates recovery and how AI can be used responsibly to enhance the counseling process while preserving the human connection that remains at the heart of addiction treatment.